Welcome to Mindful Objective, the podcast where we take a holistic approach to understanding health challenges in the modern world. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. And today on episode 12, we're diving into the complex, often overwhelming world of migraines, those intense episodes that go way beyond a typical headache. Today, we're focusing on what people really never talk about, and that's the blood flow's role in migraines and how things like medication, supplements, food, and exercise can trigger them, sometimes in a way you wouldn't expect. So you ever wonder why a muscle relaxer or blood pressure medication might kick off a migraine? Not because of the drug itself, but how the body reacts. We'll unpack that in this episode. We're also weaving into integrative health perspective, where we use functional lab testing, so think food sensitivity, gut bacteria, hormones, heavy metals, and nutrition deficiencies to dig into what's really driving your migraines. Plus, we'll spotlight medications like Nurtec and Naratriptan, how they have helped people, why they work for some, and how might we mimic some of those effects naturally. It's all about seeing the full picture. A quick medical disclaimer: this information is for this podcast is for educational purposes only. It's not intended to diagnose, treat, cure, or prevent any medical conditions. Please consult with your healthcare provider before making any changes to your treatment plan. So let's dive into the migraine journey with an open mind. So let's start by laying the foundation: migraines and blood flow. If you have ever had a migraine, you already know it's not just a bad headache. It's a full-blown neurological storm. Lights, sounds, smells, all of it can suddenly feel like it's way too much. And what often flies under the radar is blood flow. It plays a huge role in migraine puzzle, yet it rarely gets the spotlight. So this is one field that really never gets talked about, is the blood flow with migraines. So what's really going on? Imagine a slow-motion electrical storm crawling across your brain. That's called cortical spreading depression. It's an actual wave of nerve cell activity following by silence. It's like your brain hitting a dimmer switch. As the wave moves, it drags blood flow down with it. Suddenly, part of your brain doesn't get enough oxygen or nutrients. Your body responds in a panic, dilating blood vessels to rush more blood back in. That rebound is where the throbbing, pulsating pain often comes in. It's like a traffic jam in your head. First, the streets are empty, then overloaded with speeding traffic, creating chaos. But blood flow changes don't just stay in the brain. Think about how migraines affect your neck, shoulders, and your eyes. Stiffness, sensitivity, and eye pain. That's because blood flow and the tension it interacts with isn't just in your cranial event. If you ever seen a zigzag pattern, flash of lights, blind spots before a migraine kicks in, you experience aurora. That blood vessel constrictions are just actions, and many people, auroras are early signs of what yet to come. Not everybody experiences those, so it depends on the type of migraines you have, but a lot of people do. So the one thing we want to know is, why does this happen in the first place? So stress is a major culprit. It tightens muscles in your shoulders and neck, which can compress blood vessels and limit oxygen delivery. Dehydration shrinks your blood volume, which lowers overall circulation to the brain. Even environmental changes like barometric pressure drops before the storm. This can destabilize your vascular system. Your body feels these fluctuations more than you might think. So again, you hear people always say, "Oh, I have a migraine because of the weather," and that's a true fact. And here's where things get really interesting. These blood flow swings don't just happen in isolation. They interact with inflammation, nerve activity, hormones, and your immune response, all which create the perfect storm. So again, at Mindful Objective, we go beyond storm chasing. We look at root causes. Why is your blood flow unstable in the first place? Why are your vessels so quick to constrict or dilate? That's where functional testing comes into play. So let's break it down. Food sensitivities are a major piece of the puzzle, which we often talk about. They often go unnoticed because their effects are subtle and they're often delayed. We talked about that 1 to 4 or 5 days. So maybe it's gluten, maybe it's dairy. Even if they don't upset your stomach, they might be inflaming your system from the inside out. The inflammation can cause blood vessels to swell and become more reactive. Gut imbalances. So here we're talking about bacterial overgrowth, yeast, or parasites. These can produce toxins that promote inflammation systematically. Even if you never had brain fog, or if you even had it, you may have had bloating, fatigue. These are often associated with migraines. Your gut could be a hidden factor. Another one would be hormones like estrogen and progesterone. They influence vascular tone. So if your migraine spiked during your cycle, perimenopause, or menopause, that's not a coincidence. Drops in estrogen can widen blood vessels dramatically, triggering migraines. Meanwhile, cortisol, your stress hormone, can stiffen blood vessels over time and make you more vulnerable to sudden pressure changes. So that's why you might hear too that there's more women out there that experience migraines than men. But on the male side of things, I know there's still a lot of men out there with migraines. So another one is heavy metals such as lead, mercury, and aluminum interfere with nerve conduction and blood vessel elasticity. You might be exposed through seafood, old plumbing, cookware, or air population or pollution. These metals can build up slowly but wreak havoc over time. Another one we always talk about is nutrient deficiencies. These are a big trigger. So magnesium is perhaps the most crucial mineral when it comes to migraines. It helps keep your blood vessels relaxed and your nerves calm. If you're low, and many people are, you find that your system overreacts even to minor triggers. Often, you will see that with people deficient in migraines, but there are other key nutrients that people must think about, which would include B2, which is riboflavin, B6, CoQ10, which support mitochondrial function and stabilize nerve signaling. So the other thing we need to talk about is medications. So there's two big players in the field when it comes to migraines and preventatives is Nurtec and Naratriptan. Nurtec is known as a CGRP, and the better name for it is calciton gelated peptide. Sorry, got off track there. It's a protein that dilates blood vessels and ramps up inflammation in brain. By blocking CGRP, Nurtec prevents the migraine process from snowballing. Many people say it shortens attacks and stops them completely if taken at the first sign. Some people take it, as a preventative tool, reducing overall migraine days. You could take this, I think it's like every other day. They're beneficial, at certain times. They work for some, don't work for everybody. But and oftentimes too, people take them when they already have a migraine and they work after a few hours. So on the medication side, there is hope out there. So Naratriptan is a triptan, more traditional class of migraine medication. It works differently than the Nurtec. Instead of preventing the dilation, it helps reverse it. It shrinks blood vessels back to normal size and quiets overactive pain signals. It works best when used early and kept to keep a migraine at bay. And one thing to know on like triptans and stuff, a lot of these medications can cause rebounding. So, it's easy for somebody to have a migraine. They take a medication, it goes away, they get the migraine again the next day. Rather than identifying the root cause, they take another pill. Now they have another migraine, never goes away. That cycle continues, and it may be rebound migraines. So that's from the medication. So one thing to note is not everyone gets relief from these drugs. Some people experience side effects, and I know a big one with like the triptans are, chest discomfort, feel like, you're somebody standing on your chest. There's just definitely a lot of symptoms when it comes to medication. So something to think about. Others find when meds wear off, they wear off too quickly. And that's exactly why we ask, can we support this process naturally? And the answer is absolutely. So magnesium can mimic naratriptan's calming effect on blood vessels. It doesn't act as fast, but taken consistently, it might reduce how often the vessels overdilate in the first place. Ginger and turmeric are often natural anti-inflammatories. They can gently lower systematic inflammation, potentially reducing the frequency and intensity of migraines over time. Ginger tea, turmeric capsules, or even golden milk lattes can be part of the routine. Now, again, like we just talked about those medications, they work for some, not for others. And ginger may be a trigger for certain people with migraines. So keep in mind, it's not for everybody. Trial and error. So hydration is a big one for everyone. This helps stabilize blood volume, echoing what medications do to regulate vessel pressure. Don't underestimate plain water. It's often the simplest tool in your kit. In short, migraines aren't caused by one thing. They won't be fixed by one thing either. They're a tangled web of biological, environmental, and lifestyle factors. Blood flow is a major thread to that web, and we tug on it. We want to see how many threads are connected to it. So again, at Mindful Objective, we don't promise miracle cures or anything like that. Again, we don't treat, diagnose, or cure any disease, but we promise to ask better questions. So why is your body reacting this way? What's unique in your migraine blueprint? Through functional testing and a blend of modern tools and natural support, we can help you discover your personal path forward. So again, each person's migraines are different. So it takes time to kind of identify those triggers and what's actually causing it and what could help. So now let's shift gears and talk about medications, right? Because a lot of us that have migraines been through so many specialists to identify the cause. I think everybody out there that have migraines probably tried every medication in the book, and some work, some don't. Some had bad side effects, and some people aren't happy with medication. Some people want to identify the root cause. Unless you're born with a migraine, something happened in your life that caused the migraine. Is that a nutrient deficiency? Is it, something else wrong with your body? That's what we'd like to take a look into. So again, let's shift gears and talk about medications. Because you're navigating migraines, chances are you tried something again from the pharmacy, over the shelf, or on a doctor's pad. So the promise is there is options out there, right? So don't get discouraged. There's different things we could do. And for many, we know that these medications work wonders, but for others, not so much, right? I have, one thing that may work for me. I have a friend that gets a migraine, have him try to take something, and man, it causes him severe pain. So again, each person, as we talking about on each podcast, is individualized. So again, what works for one will not work for the other. And we all know that, especially in the migraine world. So they either don't help at all, help inconsistently, or actually seem to make things worse. Again, if you starting to get a migraine and you take a Naratriptan, sometimes that Naratriptan will make the migraine 10 times worse. Other times, it wipes it right out. So again, can we do that, mimic that naturally, right? Are there supplements out there? So, but again, let's start with blood pressure medications, because oftentimes physicians prescribe blood pressure medications as a preventative. So you might be surprised to hear they often are prescribed for migraines. A lot of people don't know that. Why? Because they help prevent the wild swing in blood vessel diameter that trigger attacks. Medications like beta blockers or calcium channel blockers are meant to keep vascular tone steady. No big dilations, no constrictions. But for some people, this lowers migraine frequency significantly. So again, some people may, through their physician, get on a blood pressure pill and it works wonders. Other people, not so much. So here's the catch. If your blood pressure is already on the low end, or even if you have mildly high or dehydrated, these drugs can drop your pressure even further. And that reduction in pressure can lead to slower circulation in the brain, setting off a different type of migraine altogether. For some whose vascular system is already sensitive, even small changes can outsize effects. So it's not whether the med is bad. It's about whether it's the right fit for your body. Again, individualized. Another one we'll talk about is muscle relaxers. These are sometimes prescribed if migraines come with a lot of neck and shoulder tension, which many people experience. They can help release chronic tightness, especially in people whose migraines are tension-driven. But this is where things get complicated. Once that tension releases, your blood flow can shift. If your body's not used to the new circulation pattern, or tightness was compensating for another imbalance, you could trigger a migraine in the process. So think of it like pulling a brick out of a shaky, tower. Sometimes everything settles, sometimes it falls apart. So now, again, looking at that, you have the clients that have severe tension in their neck, right? And that's the migraines causing that tension, or vice versa. Take a muscle relaxer, the neck kind of releases, but now it causes a blood flow issue. So now it triggers a more severe migraine. So again, muscle relaxers do not work for everyone. Some people they do, some they don't. So another one, which a lot of people reach out to before going to a physician or even after a physician, it's over-the-counter medications like ibuprofen, aspirin, acetaminophen. These all deserve a closer look. These are the go-to choices for millions dealing with early stages of a migraine. And yes, they often help. For me, they cause more issues. But especially when inflammation is in front and center, it's very easy to just say, you know what, I'm in pain. I'm going to, take a ibuprofen. And then find out hours later it didn't work and it made things worse. But remember, frequent use comes with trade-offs. Some of these medications thin the blood, which affect vessel dynamics. Others interfere with the gut lining or liver detox pathways. Over time, this can make your system more reactive, not less. So again, it's one of those things. It's when you're in pain, you do whatever you can to get out of pain. It's understandable, especially for those that experience migraines. They have tried everything. And, some things work, and that's what they try to stick to. But at some point in time, they don't work anymore. Or you take the medication, but you're eating wrong, and then the medication works, 20%. So there's other avenues out there that we need to investigate. So now let's revisit the stars in the migraine medication world, which is Nurtec and Naratriptan. So we covered the basics earlier. Nurtec blocks the CGRP, and Naratriptan narrows already dilated vessels. But let's go deeper. So Nurtec isn't just for acute attacks. It also has been approved by the FDA for prevention. Some people take it on a schedule every other day, for example, and find their overall migraine loads drop dramatically. But what's fascinating is how it operates under the radar. It doesn't knock you out. It doesn't dull your brain. It simply blocks the protein, which is that CGRP that's heavily involved in migraine pathway, without major side effects in most people. So now if you miss your dose, if you start taking it every other day, or you're taking, a couple of times a week, to me, it almost gets that rebound traction where you're taking it, and when you don't take it, you're going to get a migraine. So blocking that out, can it be healthy long-term? I don't know. That's where research comes into play. So now on to Naratriptan. This is more old school. It's beloved for a reason. It kicks in fast, especially when taken early. It can stop the pain, nausea, and sensitivity before they spiral out of control. It's also the one that's lower acting triptans, which makes it more tolerable for people sensitive to abrupt changes. Now, there are side effects of, gastritis, severe stomach pain, rebounding, but also for those who take Naratriptan, when you might have a slight migraine, sometimes it increases it by 10, and then it doesn't go away. Others, you might take it and it might not work for, 2, 3, 4, 5 hours. So again, nothing's a miracle out there. So why do some people work great and while some don't? That's the question we ask at Mindful Objective. And often the answer isn't about the medication itself. It's about the internal environment the medication is stepping into. So let's say your gut's inflamed from food sensitivities, dysbiosis, support digestion. That all affects how you absorb, metabolize, and tolerate medications. A drug that's well tolerated by one person, as we always talked about, may cause side effects in someone else simply because their gut lining is compromised. Or maybe your detox pathways, especially your liver, are sluggish. This could be due to nutrient deficiencies like B vitamins, genetic factors like the MTHFR variants, or toxic overload from heavy metals and plastics. So if your liver can't clear medication effectively, you may experience more side effects, or the drug may linger in your system longer than intended, leading to rebound headaches. Again, rebound headaches and migraines are no fun. It's just a never-ending cycle, and they don't go away. A lot of people, I experienced it in the past where I had migraines for months. I want to say like 3 months every single day. And a lot of times they related to rebounds. It just took time to get out of my system, but it's definitely not fun, but I understand. So hormones, once again, are key players. High estrogen, low progesterone, fluctuating cortisol. They can all affect how your blood vessels behave. They also affect the speed in which medication are processed and eliminated. Then there's your nervous system sensitivity. Some people are highly reactive to shifts in neurotransmitters, which these drugs often influence indirectly. If your brain's already in alarm mode due to chronic stress, sleep disruption, or trauma history, medications might feel too strong or just off. They may provoke dizziness, nausea, or brain fog instead of relief. A good example of that is anytime I take a supplement, I always start off at a very low dose. So if I take in a B complex, if I'm sensitive to supplementations or medications or food, I always start off slow. So say I'm taking a B complex and, we'll just say just 500 milligrams. What I would do is take that capsule and empty, 3/4 out, start with a little bit and test it out and see how my body reacts. And then if I do that for a couple days, no reaction, I increase it to, half a capsule and just do that for so long, then increase it again. So Again, my body's very sensitive. Not everybody's body's like mine, so it's individualized, but we could help. So that's where natural strategies come in. So think of them as not replacements, but regulators. Tools that support your body so medications don't have to do all the work. One of these supplements that are useful is omega-3 fatty acids. You get this from fish oil, chia seeds, flax seeds. This helps reduce baseline inflammation. They don't block the CGRP directly, but they create a less inflamed environment, making your system less prone to overreaction. Another one we did talk about is riboflavin B2. This supports your mitochondrial function and cellular energy. Several studies show that consistent B2 supplementation reduces migraine frequency. It's not fast like Naratriptan, but it builds resilience over time. Again, the key here is consistency, because we do not find this when on the integrative health side with people that take supplements. For supplements to really work, they take time. They take time to build up in your system, so you need to be consistent. Just because you get a migraine, take a B2, you say, oh, it doesn't work. That's not true. It's not working in a sense because you're not taking it long enough to get into your system. So there's consistency that has to be there. So give it a couple months. So another one is CoQ10. This helps produce energy and improves blood flow. It may not replace trypsin, but it could reduce how often you need one. Then we do have adaptogens like ashwagandha and rhodiola. These help buffer effects of stress hormones, keeping the vascular system more stable. They don't act like CGRP or serotonin directly, and they often support the terrain your nervous system operates in. So again, at Mindful Objective, we often combine functional lab testing with symptom tracking to figure out how medications are interacting with your biology. If there's a food trigger amplifying the side effects, is there a hormone imbalance making you more reactive? Is your liver working overtime just to keep up? These are a lot of questions we ask. So here's a practical tip. Track your medication response like a scientist. Know what you ate. Again, we always talk about food and like liquid intake, on your... we often talk about tracking your food and liquid intake, right? Whether it's for migraines, whether it's for weight loss, whether it's for the amount of calories and nutrition you're getting based on your vitamins, all that. Very important to track daily. So again, note all these different things. You want to note how hydrated you are, what you ate, your stress level, sleep quality, and time of day. Over a few weeks, patterns often emerge. You might find that a Naratriptan works best in the morning, but not on a poor night's sleep, or that Nurtec loses potency during your cycle when estrogen drops. So this isn't about good or bad medications. It's about asking better questions. Medications are tools, and they're often most effective when your system is primed and when you're primed and healthy to use them well. So understanding how your internal landscape shapes your experience is the first step to finding relief that lasts. Again, go based on tracking to identify the patterns, because we often introduce too many patterns all at once, right? You take something or ate something, you find out, oh man, the other day I ate something bad, but I ate 3 things that were bad, right? Or, oh, I ate this, plus I took this, plus I drank this, right? There's a lot. If you're not tracking it, it's hard to identify those causes. And again, that's when it goes to elimination, to often eliminate certain products, to identify true causes. So when you reintroduce them, you identify right away, oh yeah, that was a trigger. I stopped eating cheese for a week. I ate cheese, boom, migraine. Now you know the culprit, but it may take time. So another one we're going to talk about is supplements and food, right? We talked about medications, right, which is common for migraine sufferers. But now let's talk about supplements and foods. So these are often the first thing people reach for when they want a natural fix, and sometimes they really do help. But in the world of migraines, they're not always a slam dunk as we wish they were, just like medications. So in fact, they can be just as unpredictable as medications, sometimes healing, sometimes triggering. And again, I'm a good example for that. So reason I got involved in all this stuff, I'm very sensitive to a lot of things, but it took time, a lot of time to identify my triggers, what I was sensitive to, and how to proper introduce them to my body. Like I said, it may be I take a protein shake, it triggers a migraine. Well, why? What's in that protein shake? But not only that, maybe I'm doing too much of that protein shake, a full scoop. Maybe I'll start with a quarter scoop, with 8 ounces of water, no issues. Okay, well, is my body getting overloaded? Is it, causing problems with my liver. So let's introduce it slowly over a course of weeks, identify, how it could help. And you could build up your body to it, right? Your body could adjust to the different supplements. That's why I start off slow with, we'll say that B complex, and slowly get to a full capsule. And then, maybe I need to take 3 capsules a day, but maybe it takes me 3 months to get the 3 capsules, and that's okay. You have to do what's best for your body. So always think about that. So just because it says take 3 capsules for a certain supplement or something, that's not always the case. You could start off slow, even reduce it further by opening up a capsule and putting that capsule into a protein shake, for example. So there are options out there, but that's why we tell you to reach out. We could give you ideas and work with you on that. So let's start with the one that we talk about, you hear a lot, is magnesium. So it plays a crucial role in relaxing blood vessels and calming nerve activity. So many people with migraines are deficient but don't even know it. Supplementing with magnesium, especially in forms like glycinate and the citrate, can easily help with frequency and intensity of migraines over time. But here's the twist. Too much magnesium can lower blood pressure or loosen muscles exclusively. That shifts in tension, particularly in the neck and shoulders. This might actually bring a migraine to sensitive individuals. Again, I'm that sensitive individual. Can't talk today. I think I was talking too much throughout with different recordings, so I'm doing my best here. So that's when there is CoQ10 out there, that'll come into play. It's been great for different aspects of people's health. So CoQ10, a lot of people hear of this, especially when it comes to their heart. This compound helps your cells make energy, something migraine brains often struggle with. CoQ10 supports blood flow, reduces oxidative stress, and has some solid research backing its use. But again, not every reaction is predictable. For some, CoQ10 may increase sensitivities or worsen symptoms temporarily, especially when started at high doses. So again, start small. Now on to food. This one's even more personal. So take dark chocolate, for example. It's packed with magnesium antioxidants, which sound like a win, but it also contains tyramine, a compound known to trigger migraines in some people. Horrible trigger for me is chocolate. There's a lot of times I want something in chocolate. You can't find anything that's not in chocolate. So you're kind of limited out there. If you eat candy bars or candy and stuff, chocolate's a big trigger, and some people don't know that. They think it may help because they may crave it. And the same goes for red wine. This may be heart healthy, but alcohol, sulfates, histamines it contains can be a perfect storm for migraine-prone brains. Another one that we all love is caffeine. This is another double-edged sword. So a small cup of coffee might stop a migraine in its tracks by tightening blood vessels, but if you drink too much or quit cold turkey, your head could be throbbing for days. It's all about consistency and knowing your threshold. So again, some people are very sensitive to caffeine, others are not. So again, know your body. And a lot of people, I hear this all the time. Oh, caffeine doesn't affect me. That's common what I hear. Get off caffeine for a couple weeks. See how you sleep, see how your body functions. Then try caffeine for 1 day. And then see how you sleep that night and how you function the next day. Some people, that's where they notice. Like when they drink coffee every day, it doesn't affect them. They don't think it does. But once they reduce it or restrict it from their diet and then try it again, they see a big difference on how caffeine really affects them. So again, this is where functional testing becomes valuable. Food sensitivities tests can uncover hidden triggers. For example, your migraines not be about chocolate itself, but about the reaction to dairy in the chocolate bar. Or histamine intolerance might explain why fermented foods or wine give you problems. Same with chocolate, right? Testing the gut imbalances can provide clarity, especially if your microbiome is producing toxins that affect how your nervous system handles the food-based triggers. So again, we don't believe in a one-size-fits-all nutrition advice. It's all individualized. We believe in patterns, what happens before, during, and after a migraine. And once we have that data, we can build a strategy. That might include magnesium or ginger tea, or it might mean cutting dairy, reducing histamine load, or boosting hydration. So again, supplements and food aren't just tools, they're messengers. They tell us how your body responds, what it tolerates, and what it needs more of. When you learn how to listen and stop guessing, that's when you start healing. So another one we have to talk about is exercise. So it's a subject that divides people with migraines. For some, it's a lifesaver. For others, it's a surefire trigger. And the truth is, both experiences are valid. Exercise influences nearly every system involved in migraine physiology: blood flow, inflammation, hormone regulation, and stress response. So when approached correctly, it can reduce migraine frequency, improve resilience, and even shorten recovery time. But push too hard, too fast, or wrong conditions, and you might end up sidelined with a throbbing pain for hours. So again, for some people, it takes time to build up resilience to exercising. So we'll talk about that. But you definitely need exercise, right? Even if it triggers a migraine, you have to learn to build that resilience. Start slow, move way up, and the more you get used to exercising, the less it'll trigger a migraine. So let's talk about why this happens. When you work out, your heart rate and blood pressure rise. Blood vessels dilate to meet oxygen demands. That's normally a good thing. But for migraine-sensitive brain, those sudden shifts act like a light switch, flipping you from a balance to symptomatic in minutes. This is especially true when high-intensity cardio or heavy lifting, where blood flow changes are abrupt and extreme. So again, take in moderation, start slow. But for those out there that do intense lifting, they wonder why I get a migraine after the fact. A lot of times it's to do with oxygen and your blood flow. So we see this a lot in the weightlifting community, right? Even if they don't usually experience headache or migraines, they may only when lifting heavy weights or, extreme high intensity cardio or heavy lifting. So, and yet, the confusion is movement is medicine, but you have to do it right. So let's start with low impact activities: walking, swimming, gentle yoga, tai chi. These can support circulation without shocking your system. In fact, regular movement may help regulate your very blood vessel dynamics to go haywire during a migraine. Over time, this builds tolerance. As I touched on, your body becomes more efficient managing shifts in pressure and oxygen delivery. But again, timing matters. Exercising when you're dehydrated, underfueled, or stressed, that's asking for trouble. Adding in missed sleep, which we all experience, especially if you deal with migraines, you have a lot of sleep issues, hormone fluctuations, or hot weather, you've got a perfect storm here. So even your posture plays a role, right? A tight neck or clenched jaw during a workout can restrict blood flow to the head, kicking off a migraine later in the day. So again, it's not always instant. You may have that tension, builds up over time, and then boom, you have a migraine. So again, that's where medication is a buffer. Some people take Nurtec preemptively if they know a hard workout's on their schedule because it blocks CGRP, so they use it as preventative. So again, that's the molecule involved in pain and inflammation. It can help prevent exercise-induced migraines before they begin. Others keep Naratriptan nearby, ready to step in if the warning signs appear during or after a movement. For many, it's the 1-2 punch that allows them to stay active without fear. So that's where I think people get used to, you tolerate pain differently, but you may get to a point where you say, you know what, I know for sure I'm going to exercise, get a migraine. I'm going to take this supplement or this medication beforehand that hopefully it prevents it. Or I know, you know what, I'm not going to let a migraine hold me back. I feel fine now, but I'm going to work out. It's going to trigger migraine. But you know what, if it does, I'm going to take magnesium, or I'm going to take a Naratriptan, or I'm going to take a Nurtec at that time, or ginger, or, going down a different road. But you cannot let a migraine hold you back, right? You have to find ways to, adapt to having migraines and overcoming them, and then finding the root cause of those migraines and dealing with it. Again, if you're not born with the specific thing, there's usually a root cause. So still at Mindful Objective, we always ask, is there a deeper reason exercise triggers you? So this is where functional testing shines. Maybe it's your nutrient levels are low. Deficiencies in magnesium, B2, iron can reduce your body's ability to handle exertion. If your muscles are fatigued quickly or your oxygen capacity is low, stress movement might overwhelm your system. Or maybe it's your gut health contributing. So inflamed or imbalanced gut driven by cortisol or systematic inflammation. These are two things that vessel changes are more dramatic and recovery are more difficult. Another one is, again, hormones matter here too. If your cortisol is spiking erratically, your body might respond to exercise like it's under attack, not like it's in a training mode. Again, your body fight or flight, right? Combine that with estrogen dips and vascular systems may overreact even a very light effort. So you barely lift any weights. You walk on a treadmill 5 minutes, but you put on an incline of 2 and boom, migraine. So again, is that an estrogen spike or dip? Is it your cortisol? So then there's the other one is the toxin load factor. So again, heavy metals like lead and mercury can interfere with mitochondrial energy productions. We see this a lot when we do a hair tissue mineral analysis test. We see a lot of people with high aluminum and high mercury. It's very common nowadays, especially with, different clothing we wear, different shampoos we use, different kind of products out there, aluminum deodorant. There's a lot that come into play with heavy toxin, heavy metals. So if your cells can't generate fuel efficiently, a 20-minute jog might feel like a marathon and trigger an aftermath to match that, right? So you might say, hey, I did a 20-minute jog, but now I have 2 days worth of a migraine. Then it makes you never want to work out. I understand. So again, that's where I come into, I have the experience there. So reach out and we can discuss kind of what you're going through. So again, what's the solution? Start small, 5 to 10 minutes of gentle movement a day. Build consistency first, then intensity. Hydrate well. You may need electrolytes here. I often tell people electrolytes are key, so make sure you're using electrolytes, but there's a lot of garbage electrolytes on the market. So again, do your research or reach out if you have any questions. Eat a balanced meal beforehand with protein and healthy carbs. Often you don't see this. A lot of times you see people go to the gym in a fasted state because they're expecting to burn fat and so forth. But especially if you deal with migraines, you need to eat more often. A lot of people don't think that. A lot of people are afraid to eat because it's going to trigger a migraine. But oftentimes it's because you are not eating enough, could cause blood sugar issues too. So you want to support recovery after with stretching and rest. Track your responses. Did you feel dizzy? Did you get a headache later, hours later? Or did you wake up refreshed? Don't just measure success by the number of reps or miles. Measure it by how you feel the next day. And when you're a migraine sufferer, you may, again, lift little weights, and the next day is when you get a lot of tension in the neck and stress and stuff like that too. So, again, why are you getting that? That's where integrative perspective, we take a look at that to understand, well, you're getting tension because maybe you're deficient in those, magnesium, B2 and so forth. So that's where we go into testing, and that's what we're here for. So some days you may walk around like the whole block that you have a big win, on your shoulders. You did good, no pain. And others might feel like, man, this was horrible. I never want to do this again. But some, may be able to, walk around and be fine. Others may need to do, full yoga class and handle that with ease. So again, the goal isn't perfection, it's adaptation. So find out what works for you. Again, if it's lifting weights, that's great. If it's doing yoga, that's great. Do what works for you, but keeps you healthy. So over time, your body can become less reactive, more resilient, the more you do it. So a lot of people, again, I'll touch on this, is we get on a treadmill, boom, migraine, next day, no, I'm not working out. And it's understandable. And when you feel good, you think like, man, I want to go to the gym. But the other side of your brain says, man, if I go to the gym, I'm going to end up with a migraine. But push forward, try to get more and more workouts in, even if that's walking, because that's one thing we could do as we age is continue to walk. So at least start walking around the block, walking on a track, getting exercise in. And then maybe, another thing is get involved in yoga. That's a good stretches throughout your whole body and helps with muscle tension and so forth. So again, here, if you need help, we help you decode these patterns. With the right testing, targeted nutrition, and thoughtful movement plan, exercise can shift from foe to friend and become one more piece of your personal migraine solution. So this brings us to the end of this episode of Mindful Objective. So today we explored migraines through the lens of blood flow, which again, you never hear this in podcasts. You never hear this from your physicians and stuff. So it's a good thing to bring up too if you're working with a neurologist or a practitioner already. Bring up, could blood flow be causing an issue with your migraines? It could be medications, nutrition, your movement. So that's what we're here for. Again, we work with your primary to kind of help identify this. We're doing what's best for you. So don't hesitate to reach out. Even if you have a question, need some help or some guidance, that's what we're here for. And we can do work side by side with your physicians, your neurologist, your family practitioner, to kind of this is what you're doing on the medical side, and this is what we're doing on a subclinical side. On our side, we do different testing than the regular physicians do, so that's where integrative health comes into play. So it's often, can you get rid of your migraines from a holistic standpoint? Can you just eat better, take supplements, handle, your imbalances to get on the right path to where you have less and less migraines to where your migraines are gone? Just never know until you try. But sometimes just pharmaceuticals are not the answer. So we didn't just scratch the surface. We dug into how these factors connect to what you reveal in your body's unique patterns, and each body has their own unique pattern. So reminder, this podcast is for informational and educational purposes only. We do not diagnose, cure, or treat any illness or disease. So whether you rely on medications like Nurtec, Naratriptan, or prefer natural tools like magnesium and turmeric, we're just you got to start to track your triggers. Again, food tracking, intake tracking, your liquids, your medications, and so forth. There's no one size fits all answer. So that's where we'll work with you on everything you're going through. Say you do prefer to take a Nurtec. How can we help balance that out to where you're not taking as often, right? Now you're fixing your nutrition. Now maybe you no longer need Nurtec. That's what we'll try to get you to. So don't hesitate to reach out for that kind of guidance. So there's a personalized path forward. Just know that's what we're here for. Functional testing, smart tracking, and supportive strategies can help you build that roadmap. So if today's episode, even with all the mistakes from me talking too much, has sparked some insights, share it with someone you might want to hear this or needs to hear this. And if you're curious about what testing might reveal for you, reach out. We're here to guide you. So follow us on Mindful Objective on social media or visit us at mindfulobjective.com for more information. Migraine freedom doesn't happen overnight. It's a process of learning, adjusting, and responding with intention. We're honored to be part of that journey. So thanks for listening. Until next time, stay curious, stay compassionate, and keep tuning in to what your body's trying to tell you all along. Again, it's no one stop for everybody. It takes time. So that's what we're here for. So again, thank you for listening. Stay curious, stay compassionate, and keep tuning in. See you soon. Stay well.